How to deal with surprise medical billings. It's a big issue. As of January 1st, 2022, consumers have new billing protections when getting emergency care. In non-emergency care from an out-of-network providers at in-network facilities and air ambulance services from out-of-network providers. I know it's a lot. People with Medicare and Medicaid already enjoy these protections and are not at risk for surprise billing. Lucky them. But the people not in Medicare, through new rules aimed to protect consumers, excessive out-of-pocket costs are restricted. An emergency service must continue to be covered without any prior authorization and regardless of whether a provider or facility is in network. When a provider bills you for the balance remaining on the bill that your plan doesn't cover, this amount is the difference between the actual billed amount and the allowed amount. This happens most often when you see an out-of-network provider or non-preferred provider. These balance billings costs are in addition to what you pay out of pocket for network services according to your health plan coverage. An in-network provider, preferred provider, may not balance bill you to cover services. It's a big problem, and pay attention because this is very important. Previously, as consumers had health coverage and got care from an out-of-network provider, their health plan usually wouldn't cover the entire out-of-network costs. This left many with higher costs if they had been seen by an in-network provider. This is especially common in emergency situations where consumers may not be able to choose the provider. You're in a rush, you get an emergency, you're bleeding, you get to the hospital, and you get hit with a bill, or what they call surprise billing. Even if a consumer goes to an in-network hospital, they might get care from an out-of-network provider or doctor, physician at that facility. In many cases, the out-of-network provider could bill consumers for the difference between the charges the provider billed and the amount paid by the consumer's health plan. Well, that's the old days. This is known as balance billing. An unexpected balance bill is called a surprise bill. What a surprise that it's called a surprise bill. The Consolidated Appropriations Act of 2021 was enacted on December 27, 2020, and contains many provisions to help correct or protect consumers from surplus bills. This includes the No Surprises Act under Title I and Transparency Act under Title II. How do you fight surprise billing? Well, if both your insurer and your provider won't amend the bill, you should submit an official complaint. The federal government has a new process for you to report suspected surprise medical bills. You can do so online at cms.gov. No surprises - consumers complaint about the medical billing, or by phoning 1-800-985-3059. I put up the screen those numbers. Stop the video and write it down. Before this year, you could find yourself at a hospital with, say, an anesthesiologist that won't participate in your health plan network. You could have been faced with thousands of dollars in costs even though you had no say in the matter. Even an out-of-network provider offered you a service at an emergency facility, they can't bill you at a rate above what the in-network provider would, including any cost sharing your plan requires. If your provider submits your bill to collections, remain calm. You still have protection, so don't lose it. If you receive a call from a collections agency, inform them that you're disputing the medical bill. As a result, they shouldn't contact you for at least 30 days more while they're confirming your claim. Do not pay anything towards the bill. That would count as you accepting responsibility for the bill. Fortunately, a medical bill generally shouldn't show up on your credit report for at least 180 days. Hopefully, by then, the bill is fixed. Once again, how do you fight surprise billing? If both you and your insurer and your provider won't amend the bill, you should submit an official complaint to the federal government as a new process for you to report suspended or suspected surprise medical bills. You can do that online. I'm posting it here. CMS.gov. No surprises, consumers complaints about medical billing, or phone 1-800-985-3059. Stop the video and take a look. Write it down. Again, my name is Bill Vargas. I'm an independent Medicare agent. That means that I work for you, not the insurance companies. You know, if you or someone you know is turning 65, Medicare can be quite confusing. I represent many different companies, and I make sure that I get you the best possible coverage for the lowest possible price. So please share, like, subscribe, click the bell to be notified each time I put up a video, and please get the word out. There is new protection under the law against surprise billing. I hope this was instrumental for you. I'll see you on the next video. Bye-bye.